Our next speaker will be Dr. Mary Ambach, another colleague and friend, looking at personalized multi-target biologic injection in the spine from Carlsbad, California.
Everybody, I'm honored to be a part of this conference and present the results of our prospective case series in the personalized multi-target PRP injection in the treatment of chronic low back pain. I'm Dr. Mary Ambach. I don't have any relevant financial disclosures. The majority of published orthobiologic spine studies for spine pain is directed towards the treatment of degenerative disc disease. The studies for epidural use and facet joint pain is largely on the use of platelet-rich plasma. There's one randomized controlled clinical trial on the use of intradiscal PRP, and the rest of the studies are prospective case series. All of these studies show favorable outcomes on the pain and function in patients with low back pain. There are 2 randomized controlled clinical trials on epidural PRP, and both of these studies showed that PRP had better pain and functional outcome scores compared to steroids in patients with degenerative disc disease with or without radiculopathy. The rest of the epidural PRP studies are prospective case series. There's one that's from a prospective registry data. And again, these studies showed significant improvement in pain and function in patients with low back pain. The studies on facet joint are limited, especially the ones that are dedicated to just facet joints. There is one randomized controlled clinical trial showing that PRP had more sustained effect and improvement on pain and function compared to lidocaine and steroids. The important association between paravertebral muscle dysfunction and chronic low back pain has been studied. There's data to show that PRP stimulates myoblast proliferation and increase in muscle cross-sectional area, leading to decrease in pain and improvement of disability. Chronic low back pain, as we all know, is a complex disease, and majority of the cases have multifactorial etiology. With the potential of orthobiologics, we can more appropriately treat spine as a functional unit and as a segmental disease and address multiple structures simultaneously. Kirchner and Anitua in 2016 published a pilot study of 86 patients with chronic low back pain, and they did multi-target PRP injection. They performed PRGF injection intradiscally, intra-articularly into the facet, and transforaminally, and they showed that these patients had significant reduction in their pain after the treatments. It's important to note that all the 3 structures were injected in all the participants. Our study is the first to evaluate the effect of multi-target platelet-rich plasma injection in the treatment of low back pain by addressing multiple pain generators simultaneously, as indicated by the patient's clinical presentation and imaging studies. Our study was recently accepted for publication in the Journal of Regenerative Medicine. We enrolled 46 patients, and our inclusion criteria includes more than 12 weeks of low back pain with failure of conservative measures, including physical therapy, anti-inflammatories, and steroid injections. And the participants must satisfy criteria for the injection of the target structures. These are our exclusion criteria, which includes conditions requiring surgical intervention, severe stenosis, and medical contraindications to the procedure. The mean age of our participants is 55 years old. They had moderate to severe low back pain. About half of them had chronic pain for more than 52 weeks. Majority of our participants, 84% to be exact, have more than one abnormal finding in their MRI, of which facet joint or osteoarthritis was the most commonly found abnormal finding. Our study is the first established criteria for the selection of targets for PRP injection. The criteria includes clinical symptoms and imaging studies that are consistent with the involvement of the target structure. Our primary outcome measures include visual analog scale and Roland Morris Disability Questionnaire at 2, 12, 26, and 52 weeks, Our secondary outcome measures includes the NAS satisfaction questionnaire and the use of analgesic medication at 52 weeks. The procedure is performed by a single orthopedic physician, under imaging guidance. And the PRP is prepared using a previously published protocol that resulted to a PRP that's 4 times baseline concentration with low RBC and low WBC. These are the volumes of the PRP injected per structural target. All our participants satisfied the criteria for paravertebral muscle injection. The facet joints were the next most commonly injected structure, and the intervertebral disc was the least commonly injected structure. All of the participants had more than one structure that was injected, with majority of them receiving injection in 3 different structures. Our results showed statistically significant improvement in the mean VAS scores and the mean Roland-Morris scores in all the follow-up periods compared to baseline. The mean VAS improved by about 35%, while the mean Roland-Morris score improved by about 40% at 52 weeks compared to baseline. Patients had good to excellent satisfaction, and about 82% of them would repeat the injection if necessary. There was significant reduction of opioid and non-opioid medication use at 52 weeks, and the number of patients taking opioids was reduced by 66%. More importantly, there was no adverse events of infection, neurologic injury, or hospitalizations during the 1-year follow-up period. This was not included in our primary objective, but we tested possible factors that may relate to the response from the PRP. And we found that there was lower Roland-Morris score in patients who received epidural injection versus those who did not, and in patients who had 3 or more structures injected. These are the limitations of our study. Chronic low back pain or spine pain, the current standard treatments for them at this time is fair to moderate. We need better treatments that will result to long-term improvement in outcomes. Maybe biologics is the answer. We do have promising early data and they seem to be safe. However, there's still a lot of things that we don't know, and I make sure that my patients are informed of this. Patient education is the key. Also, although our topic is on injections, we need to be careful not to be overly reliant on procedures or injections to treat chronic spine pain. We need to educate our patients to focus on function rather than pain, and to focus on being active in spite of the pain. We need to give our patients realistic expectations on the disease process of chronic spine pain. This has been found to correlate better in preventing long-term disability. In conclusion, our study is the first to use a personalized and comprehensive multi-target PRP injection to treat chronic low back pain. Our study demonstrated safety and feasibility in 46 patients with low back pain, showing statistically significant improvement in VAS scores and RMDQ scores, and also improvement in their analgesic medication use up to 1 year compared to baseline. There were no reported serious adverse events, and we do have limitations. We recommend that further larger studies with a randomized controlled design be done to verify our results. That concludes my presentation. Thank you.